Hi everybody, my name is Dr. Mandeep Johal. I'm a general dentist here in Guelph, Ontario, Canada. I've been practicing for 13 plus years. I've been doing orthodontic treatment as soon as I graduated, and I really had a keen interest in early intervention. But I really did a deeper dive into early intervention when I had my own children, because I was really trying to understand more about the cause instead of just trying to fix what the problem was. And that's when I got into the whole airway orthodontics, and I took a lot of courses on it, a lot of courses on forward growth appliances, which is fantastic. Got into the whole tongue tie world, myofunctional therapy was fantastic. But a lot of the courses that I took doing forward growth appliances is quite challenging. Clinically, we can overcome that, but it's the compliance from the patient that's really difficult and challenging. So luckily I came across Dr. Tanner. We've taken some mutual courses together, so we were in touch, and I explained to him what I was looking for with my son because we were really struggling with forward growth with him. And he goes, "Mandy, try out my new appliance." I could not believe how easy it was for compliance for my family, for my son. He was 8 years old at that time. And I was like, wow, this is incredibly easy. So I'm like, can I implement this in my clinic? So easy. So easy to use on my patients. My patients love it because what I love about his appliance is not only do we get forward growth, we also get lateral expansion, and we can also change this angle as well, especially for our vertical growers. So his appliance is fantastic for vertical growers, and we all have them in our clinic. And those are the most challenging cases for us to deal with. So that's what I love about Dr. Tanner's appliance. And then recently I had asked him, can we use this on adults? And the reason I had approached him about adults was actually for myself. I had done lateral expansion, I had done a tongue tie release many years ago. I was feeling great. But then just recently I started snoring again, my posture started getting pretty bad, and I couldn't really put my finger on it. And then I was like, you know what, I'm really midface deficient as well. And he goes, yeah, absolutely, you can use it. And I could not be happier. So I'm going to share a slide with you that's going to show my before and after in a cephalometric x-ray. I know it's a little outdated for my American colleagues who use CBCT scans, but up north we stick with our 2D images. But you could still really see where my hyoid bone is. I know we can't diagnose airway from a ceph x-ray, but just take a look at my hyoid bone and how this jawline completely changed for me with a 5 millimeter forward growth. Headaches gone, posture completely changed. Chiropractors and osteos could not believe the change this appliance had for me. And I couldn't wait to implement it for my other adult patients because we all have non-growing patients that need forward growth. It's such a struggle to get that. So I am so grateful for Dr. Tanner to have this amazing, easy appliance to use for our patients. I had no problem using it. It was pretty easy. Kids definitely don't have an issue with it at all because kids are eating with this appliance, whereas adults, we take it out while we're eating. But I absolutely loved it actually for my TMJ as well. I forgot to mention that. So I use this appliance for my adult patients as well, but I have been using Dr. Tanner's appliances for about 3+ years now. And I could tell you at the Airway Center there, they are so approachable, very easy to work with. Any issues that you may have, they're there for you. So I encourage my colleagues that are looking into getting into airway orthodontics, try Dr. Tanner's Airway appliance. Guys, you would not regret it. It's very easy to use. Compliance is high for patients, and then you know you're gonna have a higher success rate for your results.